हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इम्पॉर्टेंट एमसीक्यू। अ 45-year-old male present to the cardiac OPD with complaints of breathlessness, palpitation and disturbed sleep. He has a history of chronic alcohol intake and consumes about 450 ml of alcohol per day. Examination reveals a dichrotic pulse on palpation and pan-systolic murmur. On auscultation, this patient is prone to develop which of the following condition: hypertrophic cardiomyopathy, dilated cardiomyopathy, pericarditis, and mitral valve prolapse. Here, the best answer is the dilated cardiomyopathy because the binge drinking alcohol leads to what? Leads to the holiday heart syndrome. Holiday heart syndrome, which might cause sudden cardiac death. Atrial fibrillation can be seen due to a change in the shape of the heart. The most common cause of DCM is alcohol. Alcoholic cardiomyopathy, which is a type of dilated cardiomyopathy, is a condition in which the shape of your heart change as a result of the muscle of your heart stretching too much. Next question: which of the following is not a high risk factor for sudden cardiac death in hypertrophic obstructive cardiomyopathy? Family history of sudden cardiac death, non-sustained ventricular tachycardia and cardiac monitoring, left ventricular septal thickness and 2 to 3 cm. This is correct because the left ventricular septal thickness of more than 3 cm is a high risk of sudden cardiac death in HOCM. Hypertrophic obstructive cardiomyopathy results from a genetic mutation that affects the interventricular septum IVS. And the defect in IVS causes the septum of the become thick when a person with a genetic predisposition of HOCM does physical exertion and nutrition need to the body increases. Next question: a 32-year-old pregnant woman present to the emergency department with complaints of fatigue, edema in the lower extremities and progressive dyspnea. On the CVS examination, an additional heart sound following H2 at the apex is heard. The physician also notices a distended jugular vein. He diagnosed the peripartum cardiomyopathy. Which of the following is correct about peripartum cardiomyopathy? Occurs years after pregnancy and delivery. Half of the patient will recover completely, and risk of recurrence in a future pregnancy is negligible. Require treatment different from typical dilated cardiomyopathy. Best answer is the half of the patient will recover completely because it is just simulated to the dilated cardiomyopathy. It has the best prognosis as a half of the patient will recover completely because the peripartum cardiomyopathy is a rare idiopathic condition that happens in the peripartum period. It results in left ventricular systolic heart failure and can be fatal. And the exact etiology is unknown, but it is believed that during pregnancy there is an imbalance in angiogenic mechanism, oxidative stress and impairment of vascular endothelial growth factor signaling mechanism, and these imbalance along with the oxidative stress cause left ventricular systolic heart failure in the peripartum period. Females with eclampsia, multiple gestation, advanced stage pregnancy and hypertension have a greater risk of developing peripartum cardiomyopathy than those without the risk factor. If the patient present with chest pain, dyspnea, cough, orthopnea and paroxysmal nocturnal dyspnea, the ECG shows what? Sinus tachycardia with non-specific T or ST abnormalities. Next question: a 62-year-old male present to the emergency department with complaints of fatigue, edema in the legs and shortness of breath. He described that his condition was that any exertion. He has a past history of hypertension and hyperlipidemia. On CVS, S3 sound along with the systolic regurgitated murmur is heard. The physician diagnoses him with dilated cardiomyopathy. Which of the following drugs is not given in dilated cardiomyopathy? Beta blocker, calcium channel blocker, spironolactone, AC inhibitor. Calcium channel blocker is the best answer because the dilated cardiomyopathy presents heart failure with the low ejection fraction. In the calcium channel blocker amlodipine reduce blood pressure but do not affect morbidity and mortality. They can cause use in systolic heart pressure as they reduce peripheral vasoconstriction, thereby decreasing the afterload for the ventricles of the heart. But in the case of dilated cardiomyopathy, calcium channel blockers have no significant effect. First generation calcium channel blocker like verapamil and diltiazem may exert negative inotropic effects and destabilize previously asymptomatic patient. Next question. A 66-year-old male present to the emergency department with complaint of shortness of breath, swelling legs and fatigue. The physician noticed that his cardiac output is low and having a murmur of mitral regurgitation. Chest X-ray and histopathology of endocardial biopsy are shown in the image. Which type of pulses would be? Here the just see this figure and this figure. What you see the multinucleated myocyte on biopsy, multinucleated myocytes on biopsy, and an increased CT. Here the increase क्या कर रहा है? CT RSU on chest X-ray indicated dilated cardiomyopathy. A dichrotic, here the answer क्या हो सकता है? Dichrotic pulse, anacrotic pulse, pulses based on pulses paradoxal. Dichrotic pulse is the best answer because the here dichrotic pulse is a twice beating pulse, twice beating pulse, palpable both in systolic as well in diastolic. In dilated cardiomyopathy causes the chambers of the heart ventricles to become thin and stretched, resulting in an enlargement of the chambers. In most cases, it begins in the principal pumping chamber of the heart, left ventricle. It is more difficult for the heart when dilated cardiomyopathy is present to pump blood to the rest of the body. Fatigue, chest pain, swelling in the lower extremities and shortness of breath are some of the symptoms connected with dilated cardiomyopathy. क्या क्या है symptoms? Fatigue, chest pain, swelling in lower extremities. Next question. A 90-year-old male collapsed suddenly after rowing a few meters in 200 Amtech event in school. He is rushed to a nearby hospital emergency where he is declared broad dead. Postmortem is done to find the cause of death following the heart specimens of the dead. Which of the does not represent heart specimens? This one, the heart specimen. A. septal hypertrophy. B. left ventricular outflow tract obstruction. C. diamond shaped cavity of the left ventricle. D. diastolic dysfunction. This is the best answer because the diamond shaped cavity of the left ventricle. The most common cause of sudden death in the young people is what? HOCM. Hypertrophic obstructive cardiomyopathies. In hypertrophic obstructive cardiomyopathies results from a genetic mutation that affect the क्या affect करेगा? Interventricular septum. The defects of interventricular septum causes the septum to become what? Thick. When a genetic predisposition to HOCM does physical exertion and the nutrition need to the body increases, which leads to more pressure on the ventricles to pump blood, but due to IVS thickening, the blood flow gets obstructed, leading to HOCM and even sudden death. In non-obstructive hypertrophic cardiomyopathy, there is no blocking of the blood. Instead, the left ventricle becomes stiff and the heart becomes unable to relax. This leads to the low cardiac output. The presence of dynamic left ventricular hypertrophy results क्या करता है? Low cardiac output in banana shaped cavity of the left ventricle seen in HOCM. Banana shaped कहाँ पर दिखता है? Left ventricles seen in HOCM. Diamond shape diamond shaped cavity in left ventricles is not seen in HOCM. And in septal hypertrophy shows a specimen of an enlarged heart with interventricular septal hypertrophy that is reducing the cavity size of the left ventricle. In left ventricular outflow tract obstruction, the image shows a specimen of a enlarged heart with interventricular septal hypertrophy. That is what reduces the cavity size of the left ventricle. Thus, it is an example of diastolic dystolic acid. The reduces the in diastolic volume significantly and presence क्या करता है dynamic left ventricular hypertrophy result in low cardiac output. Diastolic dysfunction क्या करता है यार इसका clinical feature आप लोग देख लो clinical feature HOCM include dyspnea which can be due to diastolic malfunction due to small LV cavity pooling of blood in the lungs and pulmonary edema present. So that's all and keep revising. Thank you.